I've got two hats on today. I represent Western Sydney University because this is my work time for them, and I work as a lecturer there 4 days a week, and then my other day is with Institute of Driver Health, and that's sort of a driver rehabilitation business, and we also run the driving instructor rehab course. Been involved in running that for about 20 years through University of Sydney, so we've got the intellectual property for the USID course that we continue to run through Institute of Driver Health. So I know some of you in the room are already rehabilitation trained, and we mainly work with Peter Short in our business. So if you want to ask him any questions about what it's like, you can ask him. And some of you might be wondering if this is something that you could do, because NDIS has really changed the landscape of funding for driving instructors. For people who are interested in working with people who have disabilities, if you feel like it's something you want to do, some people may not think, no, that's just not my cup of tea, but others of you might think that would be really good. Oh, we can see Michael too, we work with Michael. So yeah, let's talk about what all this might mean for you. So you all know how extremely complex driving is. You do this every day. Oh, I forgot to introduce what I am. I'm a driver-trained occupational therapist. I trained with DARE about 12 years ago or so to become a driving instructor, but I don't really work in that role, but that was interesting to do. So what we do is we rehabilitate drivers who've got disabilities, injuries, age-related changes, and so on. So you know how complex driving is. Imagine if someone has a stroke and it affects their vision and their physical ability. They've lost use of their right arm and maybe some of their right leg. They've got some cognitive problems or some vision loss. So suddenly you've got problems in all those different areas. And they've got to go on the road, and you know the road's always rapidly changing. And if people have problems in any of those areas, then they could be at risk. And a lot of our patients that come to us have problems in all of those areas. And so research does show that certain medical conditions do increase crash risk, like stroke, for example, dementia. And also, when people age, they often get lots of other sorts of medical conditions coming on, like diabetes and dementia and other things. So, and also then other people have accidents and injuries and might lose a leg in a motor vehicle accident or something. So the problem is licensing authorities have hundreds and thousands of people every year who are having strokes, brain injuries and other kinds of injuries, and so they've got a problem where there's a huge number of people with problems and they don't know who's safe and who's unsafe. So the process that they go through, I'm going to explain that today and how you driving instructors would be involved in that. So when people have strokes and brain injuries and other problems and get diagnosed with dementia, they still want to keep driving. They don't want to sit on the couch and give up their life. They want to be able to get their kids to school, get back to work so they can pay their mortgage, just like if that was you just want to get your life back. And so people with disabilities want to keep driving, or like there's a young girl with cerebral palsy and all her colleagues, or all her friends at school are driving. She wants to drive too. So people with disabilities want to drive, but not everyone who has a medical condition or disability is safe. So deciding, all right, this person who's had a stroke, are they safe? Is that person who had a stroke safe? It's sort of a public health issue because none of us want people out there on the road driving with, vision problems and cognitive problems and being at risk to other people. And yet, if you take someone's license away, you know how dramatic of an effect that'll have on people's life. Research shows people feel like it's similar to losing a lifelong spouse. That's how traumatic it is to give their license up without choosing to do so. And it gives people poor quality of life and poor health. So I don't know if you want to work in the fitness to drive space. There's people who do will tell you it's very rewarding compared to perhaps working with some of the younger drivers who, like the gentleman who spoke prior was saying, people just want to get their license and don't care about safety, and some of those sorts of attitudes. In the disability world, it's quite different. You get a lot of job satisfaction because you're helping someone who's had, say, their whole right arm amputated up to here through a horrible accident, and then they can't go to work, they can't, their life's in crisis. And then you're teaching them how to drive with a steering aid so that they can get back to driving. Within a short time, they're back on the road and they're just so grateful to you because now I can get to work, I can pay my mortgage, help my wife drop the kids to school and so on. So it is a very rewarding job on the whole. I mean, when you're working with people with dementia and taking their licences away, it's a service to the community, but it can get a bit stressful. But it's a necessary thing as well. So, and we work with a lot of high-tech modifications, so that's always a bit fun, but the goalposts are always shifting. I guess there's a bit more risk of litigation for us, but and we see all different kinds of people. One day we might see someone who has like dwarfism, so they're very, very short, their feet can't reach the pedals. And the next day someone who's a quadriplegic who's broken their neck and they can't use their legs at all and their arms very well. And then someone else is an elderly person with dementia, so it's always changing every day. So you get lots of different skills. But has anyone in the room, I mean, probably some of you already work with people with disabilities, particularly the children with autism. The rates of autism are so high. Or some of you might be older drivers assessors. Are there only older driver assessors here? Oh gosh, so you guys are picking up the people with dementia who haven't been diagnosed yet, and you're the front line sometimes for those guys, because it takes people a long time to get diagnosed with dementia, and many of them keep driving regardless. And I'm sure all of you have probably had a child with autism that you're dealing with, so maybe the parents don't tell you something's wrong, but you know something's wrong. And you might be thinking, what's the best way of teaching this person? And you might do a bit of trial and error and go, yeah, that didn't work. And then you might decide you enjoy that work, and if you need a bit more training in it, then I guess that's where we come in. So we find the best approach is to treat people with disabilities just like anyone else, just try to be comfortable. Keeping calm is really important, especially with the children with autism, just gentle approach. If your personality type is that sort of helping, caring sort of person, this might be the thing for you. Maybe others of you think, yeah, I don't think I've got the patience for that. But the thing is, people with disabilities don't need to be a special case. They still have to meet the safe driving criteria like everyone else. So we can try and help them get there with a lot more supports, but at the end of the day, if they can't be safe, then they can't get a licence. Where you come in as driving instructors, well, there's lots of people involved in the whole rehab space. There's the client themselves, there's their family, so you deal with that one every day. There's also the doctors, because we need to know if the person's medically fit to drive, and we'll talk about that in a minute. And occupational therapists do occupational therapy driving assessments with people with disabilities and injuries and medical problems. And of course, we can't go out in the car by our little selves. We need a qualified driving instructor in the vehicle, so that's where the instructor comes in. So you're in the front with the dual brake, keeping everyone safe, telling the client where to go, and setting up the vehicle with modifications if necessary, and doing your instructor role. And we're in the back seat looking at the medical side, like how does this stroke with the vision problem, the cognitive issues affect driving? Are this person safe? Are they a candidate for rehab? That's our role, and you're keeping everyone safe. And then when it comes to doing the rehab program, then that's where you come in again too, because you're the ones actually doing the rehab. So the OT will write a program, prescribe the mods, and then work with you to teach the person how to perhaps use a steering aid, or how to work with someone with autism, teaching them to drive. And you might be thinking, oh, do I need some high-tech mods to work in this area? Well, we'll come to that in a minute as well. So, we've already talked about who we deal with. So how does this process work? Well, we get referrals from lots of places. We might get one from Transport for New South Wales. We might get one from the GPs, the patient themselves, hospitals, everyone. So or even instructors. Instructors often say, look, I've been teaching this student for 50 hours. They're just not progressing. I know there's a problem here. I've just hit a wall. I think they need to have an assessment to see if they've got vision, cognitive or physical problems. So what we do is we get medical clearance for all our clients because they're have medical issues. We do an off-road assessment, which means just in the clinic we look at their vision, physical and cognitive capacity. We go out in the car. That's where you guys are in the car with us, in your dual control car typically. The lessons, you guys would be doing that with us supervising the program or writing it. And then we will add endorsements on the licence, like they have to drive with a steering aid or something. And then we work with vehicle mods. So when would you, perhaps this isn't your cup of tea, but when maybe you probably hit a student and you just think, no, there's something else going on here. I should really refer to someone who's a specialist in this area. When would you do that? If you notice someone's driving all over the road and you just feel like there's something going on here, maybe with vision, or they're missing stuff, keep using the dual brake, then that would be a good time to refer. Or with a lot of children with cerebral palsy and traumatic brain injuries and so on, they get very problems with coordination, so they're just all over the road and might be slow to learn, like with autism, it's slower to learn. You might just feel like I'm just not getting there with this person, or they've got physical issues I don't know how to address. Then that would be a good time to refer, or the slow learners who just aren't getting it. So you can send them to a driver-trained OT who will be working with a rehab instructor. And we just look at their medical history and their driving history, and we do a vision check to see if they've got any visual field loss, like maybe they've got black areas in their eye where they're not seeing properly, or double vision, or things going on with the eyes that are making the problems. Or it could be physical problems like lost use of their left leg, amputations, all sorts of issues, loss of sensation, pain, coordination problems. So we do a screen of that, and then we do a cognitive screen that looks at, this person's got cognitive problems that are really likely to affect safe driving. They really need to do further testing. This person's fallen into the safe zone on the cognitive screen, but they could be in the red zone. Often people with dementia are right in that red zone, so that's a red flag too. But the best thing you can do is just take them out in the car and see how they actually drive, which is what our job is. And if you think about how complex driving is, you've got to have good concentration, attention to detail, nice timely decision making, not being impulsive, monitoring your own self, and following the road rules and processing information quickly enough. And all these things can get quite badly disrupted through strokes and brain injuries and so on. So we also deal with people with a lot of psychological issues, like PTSD from traffic accidents or even assaults and things. But mainly from traffic accidents. So we've got some instructors who are absolute specialists in working with people with PTSD they need very special help, so we pick the instructor who's very skilled at that. We have a few that are just amazing at getting people rehabbed for psychological issues. And I think I've mentioned the on-road process. It takes about an hour. It's a dual control car with you in the front and us in the back. So you might be thinking, okay, so I do know that I'm seeing people with disabilities. What's my responsibility? Because I know something's definitely up here. Is it up to me to tell the licensing authority that this person's really unsafe? So let's talk about that now. So say someone has a stroke, gets diagnosed with diabetes, or clearly has autism that's affecting safe driving. Whose responsibility is that? Well, the licensing authority says that if that's the case, if you've got a medical condition that's come up and it's in this book here, the Assessing Fitness to Drive book, then you have to notify the licensing authority within 2 weeks or as soon as practical about this medical condition, like strokes, brain injuries, dementias. Actually, autism isn't listed as a notifiable condition, but if it's severely affecting driving, then they really should know about it. All sorts of conditions. So you can be relaxing one way. The responsibility is not on you, it's on the driver in our state. So, but you do have a bit of a duty of care. If you know someone's driving around with Huntington's disease, which often makes them terribly dangerous with jiggly arms that are making them go all over the road, but mainly cognitive problems and awareness issues. Like if someone's not aware they've got a problem, that's a really big issue, because they're just going to be driving when they've got, they're really not safe. So they're not, and they don't want to tell the licensing authority, they don't want their license to be taken away. So all you can do is say, look, I know that you've just had a stroke, or I know that something's going on here, and Mum's mentioned you've got autism and it's really affecting your driving. You do need to let the licensing authority know, because if you have an accident and you haven't let them know, then your insurance company may say, well, you've had a stroke, you're not meant to be driving, your doctor's not giving you clearance, I'm not paying for your accident. Or we've even had people go to jail in our state because they've driven with epilepsy when they were warned not to and weren't taking their medications. So there is, that liability issue. So that's the big stick we try and use to tell people to notify. And but if that's not going to work, I think As an instructor, there's not really a lot you can do except tell people their responsibilities. You can't really go off to GPs and things because at the end of the day, yeah, you can just tell them that, I guess, and document that you've done that. If someone's really unsafe, you can just report to the licensing authority. They've got a notification system, and as long as they can prove it's not a vexatious thing, there's no way you could be prosecuted for that. So that's an option too. Everyone who has medical conditions has to get this medical report form done. So if you have a teenager with autism, they should typically just be notifying on this medical form when they come, and then that just goes into the systems, and sometimes they get asked to do a test with us. You can look up a copy of that book online if you want to, but you don't particularly need to. And just to let you know, there is a special testing system for people with disabilities. It's called the Disability Driving Test, and it's only really for people who are driving with modifications. So if they're driving like with a left foot accelerator, so that's an accelerator operated by the left leg, and they're driving with the left foot on the left foot accelerator and their left foot on the brake because their right leg's out of action, then they're the sort of people that would have to go off and do this disability test, or if they've got a steering aid or something. Because if they turn up to do a normal test, the instructors will just go, no, we don't do that. And so it's got to be a special disability test. We used to be able to run our drivers with autism and non-physical sorts of problems through that process, but now they're only strictly taking people with physical disabilities. So the sorts of codes we might put on licences is must wear splint on right foot to drive. May only drive an automatic vehicle because their left leg couldn't operate a clutch, for example. Or must have an accelerator to the left of the foot brake, a left foot accelerator. Or someone who's got vision problems can only drive during the day, not at night, because their contrast sensitivity is too poor for light and dark. So all different codes available to us that are rehab codes. You might have noticed there's codes related to, like the prison system and so on, or alcohol use and so on. We have our own set of codes that are all related to disability. So you don't have to get vehicle modifications to work with disabilities because there's a lot of people that have disabilities that aren't physical. There's older people who have cognitive changes, vision changes. There's people who are younger that have cognitive issues. You can have a stroke with no physical problems. You can have cerebral palsy with no physical problems, but or very mild ones, so you can still go to a regular instructor. Or people with autism can typically do quite well with a regular instructor, or even a rehab-trained instructor. But so you really don't need to get mods to work in this space. But if you wanted to, I would definitely not recommend going and running out and spending thousands of dollars on modifications, unless you can see a really good business case for this. And even then, you only need a few simple ones. You don't need the whole kit and caboodle, not all the fancy ones like you wouldn't. Well, this is an accelerator, a satellite accelerator that's like a little cuff that hops on your hand. And this here is actually the gas pedal. So this is actually Paul Craik from Total Ability. He's a paraplegic himself. He's also the manager. So he broke his back at so this is your thoracic spine, so about T7, so number 7 on here. So that's about the middle of your back. So he can't use his legs to drive. So if someone can't use their legs, obviously they're not going to be able to use the brake and the accelerator. So we have to move that up to the hands. So the gas pedal's now on his thumb, and his brake is just a push brake on the right side. So then he can go back to work. He actually started his business. He used to race push bikes. He had his accident in New Zealand, actually. And but getting someone back to driving means he could open a business, and now he provides disability mods for people. So it really opens up the world for people who've lost a lot. So there's so many different kinds of modifications. I won't show you them all today, but some of the most simple ones is just like a steering aid. The fork-shaped one is for someone with poor hand function, like a quadriplegic, or a little round one just for someone who's still got a good hand to use. And there's a left foot accelerator right there for a lot of people who can't use their right leg anymore for all different reasons. Sometimes it's been completely amputated, or sometimes it's paralysed because of a stroke or something, or a spinal cord issue. And then we put in simple things like just some extra mirrors for people with neck problems who can't turn their neck anymore because they've got spinal fusion, for example. Or, so there's all sorts of things we can stick in. Some of them are high-tech, like the ring on the top of that steering wheel is a gas pedal. And there's the brake with the red arrow on it, and the satellite again. Or going super high tech, we've got joystick driving, which sounds like it would be easy, but you'd probably need about 50 hours of training to drive with a joystick. So it's actually really hard. I've driven with it myself, but it's push brake, pull for gas, and then steer. So it's actually opposite to a wheelchair. So a lot of people using a joystick may be in a wheelchair, and you have to worry because they actually pull to brake in the wheelchair. So they've got to get used to switching their brain around. Yes, but they take a lot to learn actually. We don't really use them very much, except for someone who might be a triple amputee. So one of my clients right now, she's got no arms. She was just born with a congenital problem with no arms, no right leg. She's only got a left leg, which is half the length of a typical leg, and she's got a foot and 3 toes. But super talented, sails boats, plays the trumpet, can work her phone and iPad and everything. She's got a YouTube channel. She's very public about her name and everything if you want to look it up. But and we're getting her to drive with a joystick, and it's just so rewarding to see someone who's 30-something and never been able to be independent in transport, being able to drive with some high-tech mods. So there are some instructors who are rehab trained, have worked in typical rehab for a long time, and then very specialise into this high-tech space. But yeah, it's pretty, a lot can go wrong, but there's some extremely experienced instructors who do that. And so do you think you should register for NDIS and work with people from the NDIS? It can be good because you typically will get a higher rate. It's also quite rewarding. We advise that you don't work in NDIS unless you're rehab trained, because you're working with people with super special needs and you might need a few modifications and so on. I forgot to say about modifications. If you decide, look, I love this, then I can see a business case for doing this. Often you will get the mods very much cheaper. So there's companies that will give, at the moment there's a company that's doing vehicles for free, for example, as long as that you've got, because they want you to have your products in your car, their products in your car. So some will do it for very, very low cost. Say Total Ability will lease the mods, so you can't on-sell the mods, but you can get them a lot cheaper as long as you're not going to on-sell the vehicle. So there's different ways to do it where it's not too expensive, and you don't need the whole lot. If you want to do it, you can ask me what exactly would you need, and I can tell you.
Just on that, would you predict that the client has their own specialty stuff whilst they're getting going through the licensing program?
We don't.
Or would you just for the sake of getting all those modifications that don't actually progress to get a license, etc.?
Yeah, we don't recommend that at all. We say just work with the instructor. Let's get your license first, and then we modify their car because it might fail. Sometimes we have to switch mods up once they learn. Like the instructor will come back to us and say, that's not working so well, and we didn't see it in the assessment, but now we've got to switch it up a bit. So yeah, we tell them not to modify their car till later. With NDIS, do you have to be rehab trained to work for NDIS? It's hard to tell you because sometimes they say yes, and in reality they do pay instructors who aren't rehab trained. I think functionally no. Lip service, yes. My view is it would be very, very good to do that. But I wouldn't be bothering about getting your business registered with the NDIS unless you really want to go into this in a big way. Because with NDIS, there's 3 streams of funding. There's people who are self-funded, so usually pretty high functioning. They pay their own bills. They decide who's going to be their provider. So they can say, I want you, instructor, to be my instructor and pay you personally. There's people who are plan managed, so they're still pretty high functioning usually, but they don't want to be involved in paying the bills and all stuff. So they get a third party to plan manage for them. And so that you can see those people without being NDIS registered, the self-funded and the plan managed. But you can't see anyone who's managed by the agency, the NDIS agency. You'd have to pay, I don't know, Michael, how much would you be looking at to get NDIS registered? A couple of...
You've got to do an audit as well. I think it was about 1,100, something like that.
1,100.
I'll just correct you on that one. Before you can register with NDIS, you have to supply them the proofs that you've got rehab training, so you can supply
okay. So they do need that now. Okay.
Well, that came up about 3 years ago.
Oh, there you go. I did not know that. So there you go. It's essential now. The course is not too arduous. It's 2 days. At the moment, since COVID, we've done it 100% online. So we're still doing that at the moment, and it's $730, I think, for the 2 days. So it's packed with information. You get a manual, and I think it's a pretty interesting course. But you can ask Michael and Peter if you want and get a separate opinion. So you may not. Actually, that doesn't sound too bad to me, 1,100, because you can access all the people who are agency managed. And how much would you get an hour? They used to have a set rate, which was 102 an hour, but they took that away because I guess it was getting a little abused, so they would rather you set your own rates, whether some people are 80, some people are 130. So it's very extremely variable. It should be based probably on your level of expertise. We have some extremely expert instructors who can charge more, and they're worth it. Yeah. I thought I heard someone say Beth. Okay, so, but to get registered, it's a bit of a process. You've got to get online, do this provider's toolkit, get your paperwork in order, get audited if you're going to be doing it with agency people, but you can still see plan managed and self-managed even without getting registered. So you might want to try that first to see if it's worth your while. You have to get a service agreement with all the NDIS participants. It's pretty straightforward getting paid through the agency. You get paid very quickly, as long as you make sure your funding's there. It's a few tricks and things, a few tricks and a few pitfalls. So talk to someone who's been there, done that. Is this for you? If you would like further training to be a rehab instructor, then there's only one course in Australia, which is the one we run, and you can go to www.driverhealth.com.au and book in. The next one I think is in May next year, and I think that's all the main highlights to tell you. Did you have any questions about this area?